The 7-year-old girl born with a huge hole in her forehead has undergone pioneering surgery to fill it, using 3D printed technology. Grace Kobelenga had surgery at 4 years old to correct her craniofacial abnormality, but a large section of her skull was removed to prevent infection. As a result, Grace, from Ndola, Zambia, has never been to school and is not allowed to play with other children as she is desperately prone to infections. Just falling over or being touched in the wrong place could have killed her, as the entire front section of her skull was missing and her brain was completely unprotected under the skin of her forehead. Barcroft 3D printed templating Cristobal. The 3D printed template before it was implanted in Grace's skull. Now Grace has undergone state-of-the-art surgery in South Africa to have a specially constructed forehead implanted into her skull to encourage the bone to grow. Grace's unique facial condition developed in the womb, and her parents Angela and Elijah desperately sought medical attention upon her birth. Angela said, "When she was born she was rushed to a children's hospital. There were so many doctors, but they told us they couldn't do anything because it was beyond their ability." Elijah said, "Grace had a craniofacial abnormality. The eyes, the nostrils, the mouth, they were all far apart." Grace Kobelenga. Grace's brain was completely unprotected due to the hole in her head. The nostrils were actually 13 centimeters apart. The brain was suspended and stuck to the hard palate on her mouth. You could physically see it outside, just covered by a thin skin. Grace's face had been forced apart by an encephalocele, a defect in which part of the brain peeks through an opening in the skull, splitting open her face down the middle. It destroyed the base of the skull, meaning there was a hole in the roof of her mouth through which her brain was hanging. When Grace was 3 years old, she and her father Elijah flew to Argentina for her first life-changing surgery. Grace Kobelenga gave medical help. Grace was born without a bone in her forehead after 6 months in hospital, being treated by nutritionists to increase her size and strength. Grace was considered ready for the 21-hour surgery, which lifted her brain and rebuilt her face. American surgeon Dr. Kenneth Salyer, founder of the World Craniofacial Foundation, who stepped in to help Grace, said, "The reason to operate was to save her life. She couldn't live that way and would not survive long term." At 7 years old, Grace's face had healed, but she still has no bone in her forehead. She wore a padded helmet and her parents had to take continual care as only a thin layer of skin protected her brain. Barcroft Grace Kobelenga pioneering Grace after her second surgery to insert the template in May 2015. Grace and her mother traveled to Tygerberg Hospital in Cape Town, South Africa, for a second surgery in which surgeons would reconstruct her skull. In order to create the new forehead, CT scans were used to construct a 3D model of Grace's skull. The model was then sent to a specialist who used a 3D printing technique to create a lattice framework, made of biomaterials, in the shape of Grace's forehead, for her bone to grow around. The surgical team, including Dr. Salyer working with Dr. Frank Griwe of Tygerberg Hospital, delicately separated Grace's skin from the membrane that sits around the brain. Barcroft Grace Kobelenga echoing Grace Kobelenga at home with parents Elijah and Angela. Once the skin was separated, the new 3D template was implanted above Grace's brain. Dr. Salyer said, "This is just guideline for where the skull would like to be. The implant is ultimately absorbable, and after 6 months it begins to break down and disappear. By that time, new bone has started to regenerate and creates a new skull." Now, after 7 years and 2 operations, Grace is finally on the way to living a more normal life.